listens earlier in the morning. Now is the time for Maternity Line Show, and you're hearing the voice of Zaynab Yakin. Okay, this hour every Friday, I come in your speakers, talking to you about what matters in the world of maternal and child health. Okay, and of course today on the Maternity Line Show, in recognition of the 2025 World Immunization Day, which was earlier on Monday. Yes, that was November the 10th. Yes, absolutely. We are discussing routine immunization and how children who are the direct recipients of vaccines and how the mothers, the enablers, you can also call them agents, okay? If you like, how can these two be better protected? Yes, that's the conversation we are having. Also, how can communities help close the immunization gap in 2025? And just so you know, this conversation is tagged Protecting Children and Mothers with Lagos Immunization 2025, because one thing is certain: every mother, every parent they also want to raise a healthy child, and now vaccines truly reaching the children who need them. So we are going to be unpacking all of these in just a moment. I'll be introducing my guest pretty soon. But before then, Lagos, be a part of this conversation. How you can be a part of this conversation, you can simply go online on our YouTube channel or even on Facebook. That's Nigeria Info 99.3. Also on social media, X, that's formerly Twitter, at Nigeria Info FM, on Instagram at Nigeria Info FM Lagos, and if you're out of Lagos, of course you can listen via the website at www.nigeriainfo.fm. But if you're watching me live on YouTube or on Facebook right now, I think I look a bit funny. You know why? I came down with some symptoms of I'm trying to understand what exactly is going on with my eye. So maybe I may be alternating by using my glasses while on the show. So Lagos, do not forget, the conversation is protecting children and mothers through this immunization, routine immunization. I'll be right back right after this timeout, and do not question why I'm wearing glasses today on the show. I'll be right back, Lagos. Please stick around.
That's not all. Every Friday, there will be a 500,000 Naira jackpot. Playing during the week automatically qualifies you for the weekly jackpot. Your chances of winning are the same whether you play on oneplay.ng or dial *347*880*3#. Remember to play responsibly. Not suitable for persons under the age of 18. OnePlay is a registered trademark under Lasho Trading Services Limited, licensed by the Lagos State Lotteries and Gaming Commission.
Are you finding it difficult listening to your favorite talk radio, Nigeria Info, via the mobile app? Come closer. Let me fix that for you. Now, launch the app on your device. Click the 3 lines on the top left corner of the app. Look for settings in the drop-down menu and click on it. Turn on the first option that you see. Make sure you turn on the option that says always use highest quality available audio. Now that you have done that, close the app and relaunch it. Voila! I did it! Oh, sorry, you did it. Now you can enjoy your radio anywhere, anytime. Nigeria Info. Let's talk.
is where it all connects, all in one place.
Federal government says it is winning the war on terrorism.
Our president is there. This promise will never come to pass.
He feels somewhat insecure just by the measure of his money.
Most of us don't even know the nooks and crannies of Nigeria. If everybody die, which voice is going to speak?
Yes, and Wike is one of the major actors in the demise of the PDP.
Getting judge case in Nigerian court is not possible.
The news, conversation, information, and more. 99.3 Nigeria Info. Let's talk. This is
Maternity Line.
Maternity Line.
All right, Lagos, be a part of the conversation today on the Maternity Line Show. I am Zaynab Yakin, and if you're just tuning in right now, this is 99.3 Nigeria Info. Even my phone is finding it very hard to recognize my face because, I don't do this all the time. I don't wear glasses except I work in the sun and then I have to put on my sunglasses. I feel very funny and awkward, but you just have to bear that with me. Because practically I am wearing glasses today on the show. And do not forget to check us out on social media, YouTube, Facebook, Nigeria Info 99.3, at Nigeria Info FM Lagos, on Instagram at Nigeria Info FM, on X. I did tell you before that short break that today's conversation is protecting children and mothers with Lagos immunization. And some of you parents, guardians, and caregivers listening to me right now may have been noticing or even noticed some primary healthcare officials moving around your neighborhood of recent, and you're curious, why are those people in our communities? Why are they on our streets? Why are they knocking on our door since the beginning of this month, especially? Yes, so just so you know, Lagos has intensified its vaccination drive, and many communities are seeing teams show up as early as the morning, checking homes for children who may have missed routine vaccines. In fact, just last weekend they knocked on my door, and I was wondering how were able to locate my apartment, because it's not a place you can easily see on the street. Has anyone pointed that? I need to be more security cautious. Sincerely, but of course, that would be one of my neighbors, because I was wondering around 8 in the morning, and I was so I was not going to allow them to administer oral vaccine on my child. But I was like, no, she's just waking up. She has not even had a bath. She's yet to brush her teeth. All of that. But they were like, no, we cannot just go like that. Reason being that the officials insisted that the vaccine could be administered immediately, reassuring me it was safe and all of that, explaining that their supervisor was around the area as well, and they needed to reach as many as children as possible during this round. So you may have experienced such earlier in the week. So that is happening right now. So today I do have a guest with me, but before I bring him on, right, Lagos, this is a conversation for you. And do not forget, our diapers giveaway is still ongoing. So we'll be talking about that much later. But now I'd love to put this to you, Lagos. What exactly is driving this urgency of the house-to-house visits across Lagos in 2025? How do these visits make you feel? Do you feel adequately informed about what vaccine your child is due for during this intensified Lagos campaign? Also, what would help you feel more confident and comfortable during these house-to-house vaccination exercises? If you have all of that in your mind and you love to seek answers, please come through, because I do have the right person for this conversation, public health specialist, vaccine advocate, is a friend of the house. Dr. Japhet Olugbogi is the guest on the show today. Doctor, good afternoon to you, and thank you for obliging us.
Good afternoon, Zaynab. Thank you for welcoming me to the show. Although I couldn't but feel that you were taking a dig at me because I wear glasses.
It has nothing to do with that, doctor. You know me now. I wasn't even that noticing all that about you, but just here I am because I don't do this all the. I don't even do it at all, so I feel awkward.
I need to see what it look like.
So apologies if I did take a swipe at you, but that's okay, doc.
No, it's fine. It's fine.
Now, Lagos, you just heard the voice of Dr. Japhet Olugbogi, and we're just going to go right into it. Now, Dr. Olugbogi, you've emphasized the link between infrastructure, water, sanitation, preventive health outcomes in Lagos, and then, I've gone through a lot of research, some of your public speaking, some of your interviews, and all of these. And then you've also noted Nigeria has millions of zero-dose children who have never had a vaccine. You've been on this show before, you talked about it anyway. But now I'd love to also put it against, before you, that in your view, what are the key problems in urban Lagos that prevents children from getting even the first dose? Let's not even go into zero dose at all just yet, because I'm aware.
All right, thank you.
Okay, please go on.
Yes, thank you once again for having me on the show. There are what we call social determinants of health, and these are societal factors, community factors, personal factors that have to do with poverty, education, income, and some environmental factors that prevent people from having equitable, if you emphasize that word, equitable access to healthcare services. So some people find it difficult to get healthcare services, the right healthcare service that they need or require at different points in time for some of these reasons. For some people, it may be that healthcare services are far away from their homes. It may be that for cultural reasons or religious reasons, they are not permitted to access modern Orthodox healthcare service. And maybe funds, poverty, limit the access to reach some people who have to healthcare services. You will agree with me that in our country, a lot of people when they go to the health facility, they have to pay from their pockets for any healthcare service that they want to obtain. And because they do not have the funds to pay, it's difficult for them to get the right service, the right care, the right vaccine that they need. Although, of course, vaccines are free in Nigeria. Some of these reasons still prevent people from getting the vaccines that they need. For instance, a mother who doesn't have money to buy food or to buy the right item for her children to eat may not have transport fare to the health facility, to the closest health facility. You'll be surprised that as low as 500 naira, some people don't have to commute themselves to the closest health facilities to them. If you have an individual that has two children that cannot take her children to the health facility for vaccination, it will be difficult for such people to access vaccination exercise. Of course, you will agree that, yes, healthcare workers take these vaccinations to the street, like you rightly mentioned and observed. They also take it into the communities. But some people still find it difficult to access, not because they don't want to, but for certain reasons that I mentioned before. It may be that their grandmother or their mother-in-law or their husband or even their father-in-law has stopped them from accessing modern Orthodox medicine, or they themselves just don't believe in it, or they just don't believe in the government or they are wary of the side events that can follow their children taking that vaccines, or they are wary of the originality or the genuineness of the people that are actually giving the vaccines. These are so many reasons that are actually preventing people from getting the vaccines, whether in Lagos or in different parts of Lagos. Earlier on, you talked about reasons why people may come down with illnesses. Our community, our society is ripe for infectious diseases. Our habits propagate infectious diseases. Our lackadaisical attitude. A lot of us have a lot of lackadaisical attitude towards our health, towards the health of the community. We throw trash anywhere we see. We dump fecal matter anywhere we see. A lot of people do not even have toilets in their homes, and you just dump everything anywhere they find. These are the things that are spread around, and of course, flies also spread, flood spread them, movements of people from one place to the other, activities of people from one place to the other also spread these ailments, and people begin to have cholera, children begin to have measles, children begin to have polio, diarrhea, pneumonia, sepsis, of course, also. So these are childhood killer diseases that are common in our environment. Even tetanus are common in our environment, and most of these are preventable by vaccination. But the question is that, are we fully vaccinating all our eligible children against these killer diseases?
Are we fully vaccinating all our eligible children against these killer diseases? Dr. Jos asked. Now, Doctor, before I go into the rollout of the measles rubella vaccine in Lagos this year and all of that, I would love for us to go back a bit to vaccine hesitancy. As you rightly stated earlier, which is, I feel like this vaccine hesitancy remains a key issue. And of course, based on your advocacy work, what are the top 2 to 3 myths or concerns you are encountering in Lagos? In Lagos mothers, or even caregivers this year. And how is your team combating that? Because while you were speaking earlier, you touched on it could be grandmother's opinion holding some of these parents back from allowing health officials administering a vaccine on the child. So how is your team combating this? How?
Yes, these are some of the challenges we face in the community. The top 2, I would say, is the lack of trust in government. And then, of course, that could closely be followed by lack of trust in the vaccine itself, the potency of the vaccine itself. The way our society is, people have lost a sizable amount of trust in government and government activities because of past poor leadership. And because of that, anything that the government brings or talks about, they feel that they are telling them lies. A lot of people actually used to carry a lot of rumors on the vaccines being used to, make them not being fertile, that they're trying to reduce the number of children that they can give. This is a very false allegation. It is not been proven. It cannot be proven. It is falsehood. People who peddle this kind of rumor do not like themselves or their children. So back to what we face in the community.
Right.
Now we are facing a lot of schools turning back our elementals on the guise that the parents do not want their children to be vaccinated. Yes, we may encounter 1 or 2 parents who do not believe in the vaccination exercise, who do not believe in the vaccine. But of course, it is not all parents that exercise from holding. And so school owners hide behind one parent or two parents not wanting their children to be vaccinated
Mm.
to totally lock out our implementers from being vaccinated. And their excuse is, if we allow you, the parents will come and withdraw their children from school. Do you want us to, to go hungry? Do you want our school to become empty? So then we have churches by the side, which is mostly the Pentecostal churches, new generation churches, the smaller ones for that matter, which are actually stopping our implementers from coming to the church to raise their children. I believe that what our implementers are doing is a discrimination. We have soldiers, policemen, other heroes who are serving the nation. The implementers that wear that green apron, the implementers that wear that yellow apron, that carry that cooler, that cold box that called a cooler, that carry vaccines and walk in the sun. They are being paid peanuts. They are being paid peanuts. What government pays them is not even sufficient for them to enjoy themselves. Yet they carry out that duty with all their vigor and all the rigor it carries. Yet you would see some people talk vehemently down on them. Somebody has attempted to pour water on me just because we wanted to vaccinate a child, just because we were trying to convince her to get our child vaccinated. Now, we earlier mentioned that vaccines are free. These vaccines are potent, they are free, they are well stored. We have means by which we know which vaccine is good or not. We have means by which we know which vaccine still remains good or not. We have means by which we know which household we are vaccinated in or not. We have means by which we know which child we are vaccinated. Yes. That's the reason why we mark those little fingers of the children. And you see, sometimes when we see a child whose fingerprint has cleaned off, we mark it again. That is an indication that we actually know what we are doing. It's a systematic effort. It's a well-planned approach. There are strategies to make sure that every stage of the exercise is well monitored, well supervised. And that's why you see a lot of senior officials, very senior government officials, senior WHO officials, UNICEF officials, even Rotary officials who are on the field, going with teams to various households, various settlements, various churches, various schools, to ensure that they comply, to ensure that they convince them to get their children vaccinated. Now, we always complain that government is not doing this for us, government is not doing that for us. But these vaccines, government is bringing to us at our doorsteps. I always say that this is one of the best public health interventions in the whole world, taking vaccines to children at home. Because I rightly mentioned that some parents, because they work, because they're scheduled, because of lack of transport fare, because of want of one reason or the other, they cannot make it to the health facility. So this kind of exercise is called a community outreach, an intensified community outreach, to ensure that people who do not have the opportunity to go to various facilities to vaccinate their children are getting the vaccines for their children. And that is why people take the pain to their doorsteps. And they don't do it in one day. They do it in 4, 5, 6 days. So that if you miss it on day one, your child miss it at home, the child can be caught in school and given. If your child did not get it in school, maybe you have left, they have left school, maybe when our implementers come, can get it in church. And that is why it is important for church owners, for school owners to be cooperative with our implementers, so that we can ensure that we vaccinate all eligible children as at when due. Now, if I give you a figure,
yes, please,
on the 5 mortality in Nigeria,
yes,
we have up to 117 children who are under 5 that die every year. 117 in 1,000. 117 in 1,000. This is a humongous number by the time you break it down. That is, out of 1,000 children, 117 of them are dying in Nigeria. This is
Sadly.
one of the highest rates in the whole world. Yes, this is one of the highest rates in the whole world. It is unacceptable. This has been lingering on. We have been seeing a little decline in this figure, but at 117, even at 100 over 1,000, it is still very high. It is 1 in 10 children that should be going to school, dreaming of becoming somebody, that will be useful to the society and the family. But their dreams are being cut short by these killer diseases that I mentioned earlier on: pneumonia, malaria, of course, sepsis, and respiratory tract infections, measles. These are preventable by the right number of doses of the vaccines. And of course, polio is there. Why would you in 2025 have a child that is coming down with polio? A disease has been eradicated in most parts of the world, save for Africa and Afghanistan. So you need to be cooperative with the vaccination teams, with the implementers to vaccinate our children. Yes, a lot of people said, Nigeria is hard. People are just going about doing those sort of things, whatever they like. Once you can confirm that these people are actually from the local government, from the various local governments, you should allow them to vaccinate your children. If you don't have information, the right information, ask them questions. Tell them to let you speak with their supervisor so that they can explain to you, they can convince you. And once you're convinced, it is right for us to allow our children to be vaccinated. Children who are vaccinated, properly vaccinated, fully immunized, are actually saving their parents a lot of stress. They save their parents a lot of money that they do not have, that they would have been spending on healthcare services. The reason why I say this is that if a child comes down with measles, an episode of measles, it is a lot of time and energy and money that the parents will have to spend taking care of that child. Money that they could have spent on something else. Meanwhile, if that child had taken 2 doses of measles vaccines, the likelihood that the child will come down with measles is very, very slim. The same thing applies to polio. The same applies to cholera. The same thing applies to so many other diseases. Of course, so we need to sensitize ourselves, and that is why this program, this kind of program that you are doing, that you are inviting us to speak to the community members about immunization. That is why it is laudable. So it is not the job of doctors or public health physicians or community members that are participating in immunization exercise alone. It is our collective effort to drive the rate of fully immunized children upwards. Nigeria has about 75% fully immunized children from the data we have from January to September. But the data that we should be looking up to, that we should be striving, the target that we should be striving to achieve is at least 84 to 90%. If we have our children, 84 to 90% of our children vaccinated against polio, against diphtheria, against pertussis, the rate at which the chances that any one of our children will come down with any of these diseases is slim, because we will have achieved what we call herd immunity, which is the level of immunity we have in the community where diseases are difficult to spread around.
All right, doctor.
But we don't have that target yet.
Okay, doctor, I mean, even time that we have would not be enough if we go into all of that from the last word you said. Now, I see people have been calling in while you were speaking, and I did not want to just break in, interject. People have continued to call again. Let me pick this one. Good afternoon, Nigeria Info 99.3.
Hi, Mary. Hi, Zaynab. Good afternoon.
Good afternoon, Mrs. Oboli.
In sensitization and awareness, Zaynab, you'd agree with me that let's keep sentiments aside. The role of the media should come to play here. Look at what you were saying in your intro. You see, I don't downplay the use of or the routine vaccines. That is why I take my children, whenever they are of age, to every of the appointments. But before you see people come at your neighborhood or come into your neighborhood, that is where the media comes in, whether conventional media, the use of newspaper, in sensitization and subliminalization of carrying us along. when the teachers or the school or the church says no, there should be a reason. But if I am aware, it was until my son came back 2 days ago and he said, Mommy, in my class, some people were taking so thing. Thank God I'm no longer 5 years old. I just laughed. I didn't know. It was until they showed up in your neighborhood. You saw them. What is the role of the media in passing across this information? Whether it's a myth, whether it's a thesis or a hypothesis, you should let us know that this is what is ongoing. How do we know? Except people just show up at your door randomly. I have asked one of them, there was a time they came when my son was still maybe 4 or 3 years old then. What exactly are you trying to give him? She couldn't even defend it until they called the superior. So I'm saying if anything must be done, it should be done holistically.
Right.
Train them properly, and then let the media let us know that social exercise is ongoing. Don't just show up randomly at our doorsteps. I'm sure the doctor should buy into what I just said.
Thank you. Thank you, Mrs. Oboli. Doctor, please hold on to that. Let me read this question out too. Is in line with that. Good afternoon. This is Rachel from Akote. Rachel says, Zaynab, please, can you ask the doctor to tell us right now what rounds of vaccine immunization is ongoing? Because, to be honest, I see them in my area. Rachel from Akote. Doctor?
Yes, thank you very much, Mrs. Oboli. Your concerns are valid and they are noted. But let me permit me to say that earlier I mentioned that we are all in this together. The various local governments on health areas have primary health care departments, and they have officers that are tasked with awareness creation, health education. Sometimes when they have funds, I use the word sometimes because it's not all the time. Sometimes when they have funds, they do what we call motorized campaigns. Now, these motorized campaigns is when they put stickers on vehicles and go around the communities. Well, you and I will agree with me that they cannot get to every door. They cannot get to every household doing this. And that is why they also carry out what we call stakeholders engagement. They carry out stakeholder engagement meetings, various stakeholder engagement meetings, and they invite community leaders, opinion leaders, artisans, youth leaders, market leaders. Yes, of course, we also know that these may not get to every door as well. But sometimes the state also put information on radio, TV. I think what we need to do is to, what we need to do is to host this kind of shows from time to time and use all our media outlets to announce this information. I've also persisted before that we're not creating enough awareness. And it's obvious from the feedbacks that we get in the community, apart from what Mrs. Roboli just submitted. It's obvious because a lot of people may not even be aware of this exercise. Yes, as to the second question, the round of vaccination we are having right now, it's called polio outbreak response. It's called polio outbreak response because the vaccines that we are taking out is polio vaccine, and in the oral drops, where the children take only 2 drops in their mouth. A next round is coming in December. I think the date is from 8th of December to 11th of December. 8, 9, 10, 11. That's 4 days in December. So the second round is coming up very, very, very soon. So we are creating awareness right now, and I'm sure that the state will have to do a lot to create more awareness on that, so that when people see our people again, you wouldn't say that you haven't heard or you do not know about it.
All right, Doctor just clarified. If you have more questions for Doctor, please send in your question, and Dr. Japhet Olugbogi is here to attend to them. Now, Doctor, let's quickly reiterate timeline of vaccination. From what age to what age can a child be vaccinated? Because some parents, once their child clocks 5, like my child is going to be 5 next month now, we go, they go, because I've not stopped anyway. They go, well, she's already 5 now, she's already 7. Mrs. Oboli also hinted earlier, and then they stop. They stop visiting the primary healthcare centers. They don't even allow the officials to administer any form of vaccination. So, doctor, when is the age that this vaccination would not be administered again? I'm aware that there is still the one for girls at age 13 or so. I know that clearly, but this particular one, when is the exact age that it can be stopped?
The routine immunization schedule that we have in Nigeria starts from birth. When a child is born, that child is supposed to take BCG vaccine, which protects the child against tuberculosis. Apart from that, after 6 weeks, the child will take some vaccines again. Yes, at birth, the child will also take the oral polio vaccine. So at 6 weeks, the child will take a number of vaccines again, oral polio vaccines and the rest. At 10 weeks, at 14 weeks, at 6 months, at 9 months, at 15 months. Sometimes the child will need to come back at 24 months to take a booster dose of the vaccine. But once they are above 5 years, they are no longer in the schedule of the routine immunization in Nigeria.
Fantastic.
But we still have a number of vaccines that a child can take. You just mentioned that an adolescent can take the HPV vaccine, which prevents against cervical cancer.
That's right,
but
HPV.
The routine immunization schedule only makes accommodation for children 0 to 59 months in Nigeria.
All right, Doctor, thank you so much. Lagos, you've been hearing the voice of Dr. Japhet Olugbogi, Medical Officer of Health at Ifelodun local government here in Lagos. He's also Assistant Director at the Lagos State Primary Healthcare Board, Public Health Specialist. He is a risk communicator, social mobilizer, and also a founder, Japhet Olugbogi Foundation. Doctor has been advocating for vaccine, UHC advocate and frequent commentator on infectious disease control and health system strengthening. So he is the right person to direct all your question, and we've had him on the show before now, and here he is with us again today to educate us further on this. Now, Dr. Japhet, a lot of your articles and information I've dug up online, and then when you say zero dose children, what does that mean? I just want us to clarify that before you go. But I do have a caller. Oh, gosh. Good afternoon.
Yeah, hello. Good afternoon.
Good afternoon.
Yeah, I would love to have some information about. I've not actually seen any of these guys around my area, so I don't really know if they have some particular place they go, or is that a kind of a way we can go to a certain place to get the vaccine, to our children, or or having numbers to call to be educated about how to get it if we have not seen those people around us.
Doctor, did you get the question?
Yes, I did. So for people who have not seen them around their area, it's possible they have passed through and you are not at home. One way to know is to check your frontage. If you see any sign written in chalk, or your gate, or the wall of your the front of your house, if they come there and they didn't see you, they must have made some inscription in front of your house. If they didn't make any inscription in front of your house at all, it's possible that somebody in the compound did not allow them. And then on a few occasions, very rare occasions, it's also possible that they have skipped your house, right? That is what has happened.
All right. It's time for the news, and Tife Olua is in the studio. Doctor, please kindly take a pause. We'll be back in like 5 minutes.
Nigeria Info, your number one for news. Always spot on. The news update on 99.3 Nigeria Info.
Lagos, you're home to 99.3.
99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens. 99.3 Nigeria Info. Let's talk.